My name is Emma Elliott. I am a final year dental student at Barts and the London Dental School, Queen Mary University of London, and I work part-time as a science explainer in the Blizzard Institute for Centre of the Cell. I'm going to talk to you a little bit today mainly about dentistry. How do you get into the profession, what drew me to it, what an employer would expect from you, and also to give some advice to a sort of 16-year-old, 17-year-old version of myself. So the first question is to tell us a little about your role and company. So I'm a final year dental student right now. I've got about a few more months to go and then I'll be a qualified dentist. As a dentist, your role is a primary healthcare practitioner under NHS England. We work to promote oral health within the community. Usually that's by treating decay, doing tooth extractions, providing dentures, and generally providing advice to the local community regarding their oral health. Once you're a qualified dentist, you can work under the NHS, or you can work as a private practitioner, or you can specialise in different aspects of dentistry. So our company, I guess, would be NHS England. They govern what we do, but most dentists are actually self-employed under the NHS, and you work in a practice of your choosing with whatever hours you would like to work. It's a very flexible profession. So the second question is, what attracted you to the role and the industry? So as I said, it's quite a flexible profession, and there's also a lot of opportunities to specialise. Dentistry is often overlooked and not as considered as medicine, because a lot of people don't realise that you don't just have to be a general dentist. Once you're qualified, you can choose to specialise in orthodontics and do braces, paediatrics and work solely with children, or even prosthodontics and do crowns and work even in root canals. You can specialise in loads of different elements of dentistry. For me specifically, it was this flexibility and also this career progression that dentistry offered, but also I really wanted something that combined art with science and with communication and a public-facing role. And there's not that many jobs that offer that kind of combination, but dentistry is inherently a very artistic career. People care a lot about the appearance of their teeth, and it does actually mean a lot to you and really boost your confidence if you can give somebody that sort of winning smile that they've really wanted for all these years. So for me, I think it was mostly the combination of artistic skills with the science, with the human anatomy, and also the flexibility and career progression. I just didn't see any other careers that combined all of those things for me. So the third question is, what pathways are there available to get into the role? So to get into dentistry, there are not that many flexible options to get into the profession. If you are 17, 18, you're going to enter dentistry through university, basically. You're going to go through UCAS, do your A-levels and apply, do an interview as well. The university course is 5 years long. It's difficult, it's a lot of hard work, but it's very rewarding. If you are a postgraduate, you already have a degree, then you can enter university as a postgraduate. You do exactly the same course, but you enter based on your degree level grade rather than your A-level grades. So to get into dentistry, you typically have to have 3 A-levels, of which 1 or 2 should be biology and chemistry, but it will say depending on what school you want to apply to. And also, if you're a postgraduate, I believe you need to have a 2-1 in a sort of science-based degree in order to enter dentistry. What key qualities are employers looking for? So I think on average, most employers within NHS England want dentists to be really strong communicators and have a good ethical and moral compass. With dentistry, unlike a lot of other NHS professions, you work quite a lot independently with just you and your nurse. So you need to have a very good, calm head on your shoulders, and you need to be able to process things as they happen, because you are the main clinician and you need to be able to respond to changes that are going on. Sometimes things will not go as planned, so you need to be quite an adaptable and calm person even under stress. So I think most of the qualities an employer is looking for is to do with you as a person, like how you are, how will you adapt to things, and how you approach things. But in general, employers will also want to see a very high level of academic achievement. It's a stressful job, but you need to have the brains that go along with it. You need to be able to think things through logically. So most employers would obviously be looking for the degree, the Bachelor of Dental Surgery degree, and also for strong A-levels and any other qualifications that you might have picked up along the way. A lot of first aid courses are very desirable. And also you can choose, like I say, some people will specialise, but some people can also do courses in sedation or Botox that can bolster their CV and make them more desirable as a candidate to work in a specific surgery. So if I was to describe a typical day or week at my work, which is the next question, what is a typical day or week at my work? I'll go with a week because dentistry is quite flexible and a lot happens over the course of the week. So right now as a student, my week is split amongst lectures, treating patients that are both paediatric patients and adult patients, and working in the labs to practice my skills. So I think on average I'm in roughly 9 till 5 every day. I do adult and paediatric work on Mondays and Tuesdays, lectures on a Wednesday morning, and Thursdays and Fridays I will often spend time in the clinical skills lab learning and refining my skills in root canals, crowns and simple restorations. There's also often, I think the last time I was on this rotation was a Friday afternoon, but we would go to oral surgery on Friday afternoons and basically extract teeth, take out patients' teeth. So it's a very hands-on degree. I've been seeing patients since the end of my second year, and in some institutes that can be even earlier actually. So if you want to do dentistry as a career, you have to be prepared to get very hands-on at a very, very early stage. Generally, during this week, I will spend some time working at Centre of the Cell. Like I said earlier, my role there is as a science explainer, which is a public-facing communications role, which when I said earlier, what kind of skills or things would an employer be looking for from an employee within dentistry, working at Centre of the Cell is one of those things that I can bring up to demonstrate my ability to communicate with the public and with children in particular. So often I'll probably do 1 or 2 shifts a week with Centre of the Cell, and then spend the rest of the time studying and trying to get towards and through all of my exams that I have to do as an undergraduate. A week in the life of a general dentist is a very flexible one. Some practices that you'll work in will want you to do a 9 till 5, other practices might want you to work on a Saturday, but you can very much dictate your hours as an associate, your hours as someone who works within that practice. So typically as a general dentist, you'll be treating patients day in, day out, all week, and you'll see on average about 30 patients a day. And you'll have a contract with the NHS where you have mutually agreed between you how much dental work you're going to provide in the local community. Now, as part of that, you can then go on and specialise. No one has to stay as a general dentist, that's your baseline job, and then you can choose to stay there and be quite happy, or you can go off and specialise within root canals, crowns, paediatrics or orthodontics. There's loads of different options to specialise within dentistry. So finally, what key advice would I give to my 16 or 17-year-old self? I would advise anyone to take on as many opportunities as you're presented with, because part of your future career, no matter what it is showing that you are a well-rounded, adaptable individual who is able to take on challenges and socialise and speak with the public. Most employers will want those skills, so it doesn't matter what it is, if it's working in a charity shop, if it's volunteering at Scouts, if it's getting trained as a lifeguard, any opportunity that presents itself, you should take with both hands and go with it, because everything can always be used to demonstrate skills to any employer in any industry. And that's all I have for you. I hope you've enjoyed hearing about dentistry, and I'd like to thank you for listening to me, and I wish you all the luck in your future chosen career.